All right, so I'm going to move into kind of a different update today. I'm going to be bringing an update for COVID-19. And I'm changing the process today as I bring this update. And you might ask, well, why now? Why change the process now? You have been communicating via the web page, via the weekly updates. I started this process last week when I communicated to our team members and to the community at large through our weekly update about the numbers that we had been seeing drop dramatically in our school district. We're very pleased with that drop. Unfortunately, what is driving this change in the way that we're bringing updated information is, unfortunately, we have witnessed, as recent as over the last couple of weeks, some organizations choosing to make decisions based upon emotion and/or politics. While I have been accused of making decisions based on politics, this district has been utilizing data to drive the decision-making process. Regrettably, accurate data has been lacking in presenting a full picture of our current environment. So today, I will be showing some of our data that has been utilized thus far. And I will also be making these slides available on our webpage tomorrow and linked into the weekly update that is going out. Next slide, please. I said please. Starting out with part of the problem today. It seems that false information is picked up quicker than accurate information. As you see on this slide, the 3 steps that provided this false headline. A state epidemiologist made the comment of 60% of outbreaks are in Georgia schools, which in and of itself can mean as few as 2 students testing positive in one place and does not have a direct tie to the overall number of cases. Number 2, a reporter says 60% of new cases are in Georgia schools. And then that false report gets picked up by multiple outlets, including CNN. So this is not just a local newspaper out in the country somewhere that just happened to make a mistake. This was very widespread. And local citizens, upon catching the error, confront media outlets, and some have still not corrected the false headline. And what's the result of that? Parents and students are left greatly concerned by a false report that exaggerated actual case spread by over 300% when cases were actually falling sharply. That is why I'm trying to bring accurate information to the public to consume about our current situation instead of the false information that is being spread. You can see on this same slide, 1 week ago, that's the headline. Yet today, in the Atlanta Journal and Constitution, greatly appreciate this article. Atlanta area school districts report a sharp decline in COVID cases. Next slide. Now, this graph may look familiar as it was in my weekly update last Friday. However, I want to reiterate what this graph shows and bring a little bit more information to the forefront. Cases among all Cobb students and staff are down 44% in the last 3 weeks and have fallen in 90% of Cobb schools. Again, over 97% of students and staff are COVID-free. Yet to hear the data being presented would seem to be the exact opposite of the actual situation. candidly, the graph you're seeing covers the time period from August 27th to September 17th. Interestingly, in the middle of this graph is when the emergency Cobb Board of Health meeting was held. Now, you might be asking, well, why wasn't this discussed during that meeting? Since obviously the numbers were already falling and falling to the point of accumulating to a 44% fall. Next slide. Now, I apologize for the complicated busyness of this slide. However, it's a good thing because the busyness on the far right side of the slide shows that all of these districts are falling to the same cases per capita. Now, I've referenced on the bottom of the slide, which you can read. I'll read it once, but I won't read it again. You can see it online when we place these slides on our webpage. Per capita student infection rates equal the cases divided by enrollment, adjusted for community spread, and obtained from the following sources: COVID-19 information portals, Marietta City, Atlanta Public, Fulton County, Douglas County, Georgia Department of Public Health. And the reason that these numbers and these districts are represented is these districts represent the data in similar and accurate formats so that you can compare apples to apples instead of how some media outlets have attempted to do, compare apples to, I don't know, dump trucks. And that's not a very accurate comparison. However, what you see represented here is a significant drop in cases. Now, interestingly, on this slide, Cobb is the only district where masks are optional and have been since day one. But what you will notice that's interesting is at the end of the slide, from that time period of September 17th from August 27th, you can see that the cases per capita have dropped to 0.004, 005, and 006. Now again, there are 3 districts in the middle where Cobb is one that have dropped to 005. So again, I apologize for the data, or the numbers rather, overlapping. I don't apologize for the data overlapping because that's a good thing. Now, one of the questions that you may be asking looking at this slide is, well, wait a minute. Maybe if Cobb had required masks, we might have dropped even further than 44%. And that's a very valid question. Next slide. Because what you're looking at are school districts in the entire metro area that dropped to a similar point at the end of this time period of September 17th. Now, some districts that are represented here dropped as much as over 70% compared to our 44% drop. So again, you could be asking, why didn't we drop further? And perhaps a mask mandate could have caused us to drop further. Next slide. The reason we didn't drop further is because our peak spread was much lower than any of the other school districts represented here. So as you see, our peak represented on the left side had the lowest peak in the Northwest corridor. But the takeaway from this slide is regardless if you as a school district drop 70%, 44%, 50%, 10%, the point is at the right side, as of the last Friday, September 17th, all 4 districts have statistically identical spread. Next slide. Now, I've gotten emails and heard comments about, well, why don't you just do what you did last year? Because it worked so well. We were able to stay in school. We had a mask mandate and everything was great. And that's a very valid question. So what you're seeing here is for illustration purposes only. This is not an accurate depiction of data or phenomena. This is what we expected to see last year. Because again, that's a very valid question. We had things in place last year. We were following CDC, CDPH guidance to the T. So we would have expected to see exactly what's represented on this slide. Cobb being significantly lower than other unmasked districts. As a matter of fact, the CDC was quoted in late 2020, CDC director, that masks perhaps would provide more protection than the coronavirus vaccination. Next slide. This is what we actually saw. Can anyone pick out Cobb? Let me help you. It's the line in the middle. So when you're looking at a comparison of these districts, Cobb was the only district on this graph to require masks. We mandated masks. And matter of fact, you can see from the box on this graph, this time period is from January through May. This encompasses the peak of the winter case surge. Now, the most important takeaway from this slide is again at the end in May. Cobb, with a mask mandate, is in the middle of the 5 districts. We have 2 districts, mask optional, that had higher spread than we did. We had 2 districts, mask optional, that had lower spread than we did. The data clearly indicates a mask mandate does not provide a significant change in the cases. Next slide. Now, some of this data has been taken from the one study that the CDC conducted on student masking in 2020, and it was conducted in Georgia for 90,000 students. And one of the results that's quoted from this study that the CDC conducted is that student masking could not be said to be effective. Most notably, requiring student masking was found to not have a statistically significant benefit. In other words, these measures could not be said to be effective. Now again, according to that study, it was the first study of its kind to compare COVID-19 incidents in schools with certain mitigation measures in place to other schools without those measures. The study was also conducted during a period of rapid spread in Georgia as the winter surge had begun, during a time where cases grew by 103% from a 2,943 average to a 5,999 daily average. The significance of comparing dozens of schools with mask mandates to dozens of schools without mask mandates cannot be overlooked. When masks were declared a public health measure, it became unethical to do a randomized control trial because people would have to agree to not wear a mask. So while everybody wants to reference articles written by this person or that person and these studies, this is the one CDC study conducted to look at the efficiency, or the effectiveness rather, of mask wearing in students, particularly in elementary schools. Again, according to the CDC, this was a, quote, first of its kind study to do a large-scale comparison of thousands of school students in the same place to assess, among other things, effectiveness of student masking. Now, the comment I made about the declaration public health measure of masks is important because, again, it prevents a controlled study of this type from being utilized again or conducted again. Next slide. This is a lot of words, but I believe it's important enough to read the entire quote. Because what we have seen is the situation of people trying to use different levels of credentialed individuals to justify one side of an argument or the other. This is a quote referencing the study that I just mentioned from Dr. Alyssa Schechner Perkins, who is with the Boston University School of Medicine, Master of Public Health, specializing in infectious diseases and emergency medicine and pediatric immunology, said as follows, and I quote, "We don't have data they," referring to masks, "have any impact on any important clinical outcomes in the school setting. A year ago, I said masks are not the end of the world. Why not just wear a mask? But the world has changed. There are real downsides to masking children for this long with no known end date and without any clear upside. I'm not aware of any studies that show conclusively that kids wearing masks in schools has any effect on their own morbidity or mortality or on the hospitalization or death rate in the community around them. I don't think that Delta changes the calculus because it still seems clear that it doesn't cause more severe disease, so it still doesn't change the fundamental question of what are we trying to achieve by masking kids when they are still extremely unlikely to suffer from severe illness or death if infected. And the adults in their lives have the opportunity to be vaccinated and also protected, so we don't need to worry about transmission. Even with a new variant, the onus is on those who recommend masking kids to robustly demonstrate a meaningful benefit, especially when the pre-Delta study of the Georgia schools did not find one, and where there are obvious socio-emotional and educational harms from masking children for this unprecedented duration of time." Next slide. Moving forward, one of the foundational principles of education is to engage in data-driven decision-making. And the Cobb County School District will continue with a data-driven and forward-looking process that mitigates disruptions and the learning loss it causes. Addressing learning loss is one of the most important things that we face today as an educational institution. People are, in my opinion, and many others, have dramatically underestimated the amount of learning loss that has taken place over the past 18 months and what it's going to take to catch these students up. What comes next? The Mu variant, Lambda variant, another winter surge. Our staff has not received a forward-looking process from public health officials, so CCSD will be drawing upon all available resources to prepare our community for all eventualities. As cases continue to fall, Cobb County School District will be doing a full lessons learned from the Delta variant surge. To continue being a learning organization prepared for what is coming, we must continue learning from what has happened. The news being better today does not mean it cannot be worse tomorrow, and we will strive to be prepared for whatever comes. We need to know three things: what is happening, why it's happening, and what is going to happen next. We have to have answers to those questions that are derivatives of data. Now, while most of my comments today in data has centered around masks, I want to reiterate again, this district is not, has not, nor will not be anti-mask. We strongly encourage mask utilization. We strongly encourage those that are comfortable to become vaccinated. However, we are focused on that being your decision as a parent, as a family, as an employee, to work and communicate, collaborate with your personal medical care provider in order to come up with your decision. And that's where it remains, is your decision. We will not be requiring vaccinations to be employed in the Cobb County School District. Masks will continue to be strongly encouraged, but will be optional moving forward. Now, I want to also end today with the next step that we're going to be conducting regarding analyzing data related to not only contact tracing, but quarantining. We recognize that students are missing instructional time and days due to being quarantined for something most will never become positive with. Again, when you look back at the graphs, and as you have the opportunity to look at those tomorrow when they're online, I will give kudos to Cherokee County. This is not a competition. We are in it to win it together. And when Cherokee had a 70+% drop, again, due to their peak was much higher than ours, contact tracing and quarantining, they're a much different protocol than we have. We need to understand that. We need to look at the data related to that. And we need to figure out where we need to tweak our protocol, again, given the authorization by the administrative order from Dr. Toomey and Department of Public Health. Much appreciated. Because again, as it says here, and as I've already said, good news today does not guarantee good news tomorrow. We may find the situation that happens where the virus, a different variant shows up that's resistant to vaccine and herd immunity and everything else that's out there as far as mitigation strategies. And if that shows up, we need to be prepared, which we will be, we have been, and we will continue to be. But again, I felt that it was time to actually put an accurate depiction of data for our community, our parents, and our stakeholders that we will continue to use as we move forward. And again, when we're not presented with a forward-looking process, we will use all available resources at our disposal to come up with exactly that. So, that concludes the COVID-19 update for today. I don't know if we will continue to have presentations like this, but I will continue to communicate to the public, to our team, to the stakeholders in the weekly updates should the data situation change, and I'll keep you abreast of what those changes are.